It's my pleasure on behalf of Consumers for Quality Care to welcome all of you to the screening of an important, impactful documentary, InHospitable, and to an important panel discussion about the nonprofit hospital practices. My name is Donna Christensen. I'm a family physician and a retired member of the House of Representatives. I had the great honor of being the first female physician in Congress and served not only as chair of the Health Brain Trust for the Congressional Black Caucus, but also on the Health Committee during the creation of the ACA. That was a highlight of my time in Congress, of course. So I'm proud to welcome you here on behalf of Consumers for Quality Care, a coalition that I, Jason, and Jim Manley founded a few years back, 6 years ago actually, to ensure that patients remained at the forefront of the healthcare debate. We believe that high-quality healthcare should be accessible and affordable to everyone. But across the country, we've seen a truly problematic trend in hospital care. Nonprofit hospitals, which receive billions in tax credits to serve local communities, are acting like big businesses. Actually, some of the big businesses are doing better than they are, with one thing in mind: profits. From mergers and acquisitions that leave longtime patients out in the cold, to nonprofit hospitals skirting their charity requirements while hounding low-income patients for unpaid bills. Hospital systems are prioritizing profits over patients and the communities that they're supposed to serve and care for. So I'm going to turn this over to my colleague, Jason Resendez. He's going to tell you more about InHospitable, the film which you're about to see, which exposes our dysfunctional healthcare system and how the big business of nonprofit hospitals impacts real people. So sit back. You're going to be truly impacted by what you see tonight.
Thanks so much, Donna, and thank you all for joining us tonight. My name's Jason Resendez, and I'm a board member of Consumers for Quality Care and also president and CEO of the National Alliance for Caregiving. I've spent my career advocating on behalf of America's 53 million unpaid family caregivers and the patients that they support. And I'm always shocked but never surprised by the stories, like the stories that you'll see in this incredible documentary, InHospitable. Stories that capture the harsh reality that too many American families face when healthcare entities like nonprofit hospitals focus on maximizing profit over providing the charity care that so many communities and patients rely on. And when that happens, it's patients, communities, and families that lose out. That's why Consumers for Quality Care is excited to share this important documentary with you tonight, and not just share the documentary, but also to host this panel that brings together the film's director, Sandra Alvarez, joining us alongside Miss Vicki Arnett, whose powerful story you'll learn more about and what you will not soon forget, the story of a fierce advocate, a caregiver, and someone affected by the egregious actions of nonprofit hospitals. And also Frederick Isasi, who I practice that so much, Frederick, you have no idea, who needs no introduction, has been a longtime advocate on these issues and other issues, putting patients ahead of profits. I'm also happy to introduce Rina Shah, who is with us here to moderate the discussion tonight. Rina is a contributor to The Hill, a strategic consultant who's been a counselor and senior aide to 2 Republican members of the U.S. House. We're excited to have her here to moderate this discussion. Thank you again for joining us, for taking what you learn here and sharing it. This is the DC premiere of InHospitable, so we look forward to seeing this spread and the message spread across this country through your advocacy and action. So thank you so much. Over to you, Rina.
Good evening, everyone. I'm so glad to see you in such a beautiful venue tonight. What a treat to be here at the Miracle Theater. First, let me start by thanking The Hill, a publication I've trusted for nearly 20 years, from when I first became a Hill staffer, and to now, as a political strategist. I rely on The Hill, and I thank them for this incredible event. Also, Consumers for Quality Care. The work you're doing is so important. I'm the daughter of somebody that was a caregiver for about 10 years. My mother did the hard work of really taking care of my dad before his passing for a decade. Frederick, Families USA recently released a report titled Bleeding America Dry. You're holding it. Can you tell us just a quick tidbit about that?
Sure.
And why they should all read it?
Sure. So there's hard copies available in the lobby. Grab one. I think this will basically give you, from a policy perspective, what's really going on here. Why are we facing this problem as a country? And in sort of the way I would the way I would summarize what's happened is, I think we've all knew. I mean, I'm a kid from the 70s, right? And there was that local hospital down the street. And, I literally remember bake sales to help support their maternity ward, or, the sense that this is a community resource and we all come together to support it. That slowly but surely has changed year after year after year. And basically what happened was that local hospital became a health system. Over time, that health system, really in the last 10, 15 years, that health system became part of a mega corporation. And what's really happened is that the care being provided by hospitals has been taken over by corporate interests. And those corporate interests are being rewarded for maximizing revenue, maximizing the amount of money that they're generating. But there's no link to quality, there's no link to outcomes, and those mega corporations have been consolidated both vertically and horizontally, meaning with each other and with physicians. And as a result, we've seen prices increase astronomically. So right now in this country, we're spending 2 or 3 times more than the rest of the world on healthcare. We have some of the worst outcomes. Our moms and babies are dying at higher rates. You're more likely to walk into a hospital in the United States and die when the hospital should be saving your life than most other developed nations. We are not getting the care that we deserve. We're spending way too much money. And ultimately, it's because instead of focusing on what the American people want, which is to live a healthy life, to be able to receive care affordably, to not receive a surprise medical bill, a financial bomb go off when they're trying to care for themselves. We're now in a place where the corporate interests of healthcare have taken over and are pointing those corporate resources at money, high margins, and I'm here to tell you, I think the thing that's hardest is on a policy level, they are working at every stage to block any kind of reform that could hold them accountable to providing high quality care that's meeting the needs of America.
Frederick, there was a bill in Congress recently about surprise medical billing. Can you tell us more about that?
Sure.
And where that stands? Because it seems to be one of the biggest, most important bits.
Yeah, there's some, it's one of the things. So we were very involved in the No Surprises Act. I'm really happy to report it was a hard fight, but we actually, we won. It became law a couple years ago. And basically, it stands for the principle that, a lot of people don't realize that you pay your health insurance every month, right? And you might need care. And when you go to the hospital, if you're lucky, there's a wonderful woman we work with, Sanjay Wilkes from Colorado. She had given birth. She received a very high bill. She had me spend, I think, about $6,000 after the delivery of her baby, even though the hospital was in network and it should have all been covered by insurance except for maybe a few $100s. So that second child, she went into overdrive. She knew her family could not, after having a little one and having a second one, they could not afford thousands of dollars in medical bills. So she went, she talked to her health insurer, she talked to her hospital, she went through every single person that was going to provide her care and said, everyone's in network. It was a check. So she knew she was only going to get maybe $200 worth of cost sharing at the end of their birth. But what happened was, when she gave birth, she didn't realize that she was recessive for hemophilia, and she ended up giving birth to a little baby who was a hemophiliac and was bleeding out. So they took that little infant and brought it next door to the room next to the delivery room, the room next to it, and gave her the clotting factor, and then she's doing great. But then they got home, and about 6 weeks later, they got a bill for $40,000.
That just seems absolutely absurd to me.
$40,000.
When you touched on something really quick and talking about corporations, physicians, and I think of the care providers, our nurses, our doctors, who are frontliners. And again, you heard my story being so close to medicine. I'm curious, Vicki, can you touch on that a little bit about what Frederick just said about being a nurse? Taking the hat off of Maurice's wife for a moment, who we want to honor his memory tonight. And I am so sorry for your loss. I can only I cannot only imagine, I know it, what you must have done. And he's here with us tonight.
Oh, absolutely.
Thank you for sharing these beautiful pictures.
Yes, absolutely.
But I do think, Vicki, you play such an important role, having worn both hats. Can you touch on the corporate bit, tie that into your experience, please?
Hi, everybody. I'm so pleased that you all came to visit and share in the experience of this film. I have a very unique perspective because I've been a nurse for 23 years. I don't know, I'm getting old. And I've worked with UPMC Health Systems for 13 years, and I worked with Allegheny Health Network for, I believe, 4 years in hospital per se, and then I continued to work as a nurse, as a private duty nurse, work with the hospital health systems. I work as a pediatric critical care nurse, in-home hospice nurse, chemo. I do it all. And the crazy thing is that as a nurse, I am a licensed practical nurse, not a registered nurse. I am a nurse that is on the floor, on the ground, doing the grunt work. Army has grunt workers. Same thing in healthcare. I am probably one of the most highly trained licensed practical nurses in probably this country, honestly. And so I get a chance to give a unique perspective because I also had to care for my husband, who had the upper echelon of Highmark Insurance, and also, we have the premier medical cancer treatment center in one of the premier groups from UPMC, which is Hillman Cancer Center. Unfortunately, because they were in the middle of a fight, I really still to this day believe, because of the delay in care, that we were able to, that his life was probably shortened a lot.
Vicki's husband, Maurice, should still have had a chance beyond what he was told. And a fight between Highmark. I mean, like you said, upper echelon of insurance. Don't we all think that's a little just wrong, right?
Well, let's not forget, too, this upper echelon of insurance, Highmark is based out of Pittsburgh. And so when I would not accept my husband's life sentence, nobody's putting a tie stamp on him other than God. So I'm fighting. And so I checked at Cancer Treatment Centers of America, which is headquarters in Philadelphia. He was out of network. But he was in network in Chicago and Philadelphia. Chicago and Atlanta. I then had to cash in my 401k and say, he was 54. He'd be 57, going on 57 now. He died at age 54. I am now 62 and restarting my whole life all over again due to medical debt, having to spend $300,000 on my husband's care. So,
And Vicki, I was going to make the point too that when you talk about shortages, at the same time that we don't have enough nurses and we don't have enough pediatricians.
No.
We have CEOs making $20 million a year easy. They're making 400 times more than the average person working in their hospital. Right?
Oh, no, but the best part is when they spend $2 million on a piece of artwork, instead of paying off those people who really need to have them come in and rescue them as a nonprofit and pay off those medical debt.
It all feels very upside down, but Vicki,
Yeah.
through you sharing your story and what you've seen, your observations and your suggestions, I do believe reform is possible in our lifetime. I really do, because again, I've grown up thinking hospitals are the safe place that don't need reform. They're great. They're good actors. So let's bring you in, Sandra, please. Yeah. This is watching your film did give me goosebumps, because hospitals, again, are this place where they were my second home, and it's because I trusted them. And UPMC is a place I trusted. But I want to bring your words in here before you give us your live words. You said, when speaking about the film, we all know we have an incredibly broken system. You hear a lot about insurance. You hear a lot about pharma. You hear a lot about medical devices. But in the public consciousness, there's not a lot of discussion about hospitals. So why do you think that is? Because again, we're about to screen your film. But why do you think there's just not enough conversation about hospitals?
I will answer that question, but I wanted to speak to one thing you mentioned about where you gave birth, because I was pregnant when I started filming this.
Oh, that's amazing.
And I ended up, because of everything I learned, I gave birth at home to birth both of my babies.
Congratulations.
So
that's a great decision. And one that I did consider, by the way, but again, as a wife of a physician, was not
Yeah.
Anyways.
Yeah, that
couples,
gives you a sense of
you know.
how shocked and scared I was about hospitals by the end of this. But
That's amazing, Sandra. Thank you
yeah.
for sharing that.
But hospitals, yeah, I mean, you know, UPMC, as you'll see in the film, they are the largest employer in the state besides the government. You know, they're incredibly powerful. I had never been to Pittsburgh before filming, and you just drive around Pittsburgh, and every single place you turn, there's a UPMC sign, there's a UPM billboard, there's a UPMC bus stop. I mean, it is everywhere. They have
Probably sponsoring baseball teams even.
Oh,
I mean,
oh, yeah,
Little
yeah.
League,
You go
right?
to the
They do
Steelers
everything in the community,
yeah,
right?
you go to the Steelers game, and there's a huge UPMC sign in the you know, the stadium. So, you know, they're incredibly powerful, and they also, because they're a nonprofit, they have to spend their money somewhere, so they're contributing to local organizations, and they have people on their board, so they have their hands in so many pieces in the community, not to mention that they own huge swaths of land that they don't pay taxes on, right, in Pittsburgh, and the city of Pittsburgh loses money on that land. So yeah, they're really powerful, and not to mention they save our lives, right? I mean, 3 months after I started making this, my father went into cardiac arrest. Thank goodness he's still alive now, but you know, he spent 3 months in the hospital at Jackson Memorial in Miami, and they saved his life. So I was making this documentary about hospitals, but at the same time, they were saving his life.
But, and here's the thing: they're saving our lives, no doubt. 250,000 people a year in this country die, not from their illness, but from the healthcare system. Absolutely. They're also killing people.
Right.
They're also killing people.
And
Yeah. But the question was why not hospital? Why are people talking about hospitals? And I think that's the answer is, you know, we see our doctors who are saving us. We see them as, you know, oh, they're providing, UPMC is supporting all these local organizations. They're the largest employer. And not to mention, you know, they have a lot of lobbyists. You know, in the state capitol in Harrisburg, that's what we heard a lot from the state politicians is, you know, before the movement that Vicki and all of the patient advocates put together that you'll see in the film, before that movement, the state politicians, the only people they had heard of about anything to do with hospitals were the lobbyists.
That's right.
So you're saying that you've said that every politician that's featured in the film tonight has been reelected. Is that correct?
Yeah, so that's one of the really exciting things. You know, every single politician that actually took on UPMC, spoke out publicly, joined the grassroots movement that was started by the patients and the workers, they were all reelected, not only reelected, but elected to a higher office. Yes. You know, our state representative, Summer Lee, is now across the street, right? Yeah. She's in Congress. State Representative Ed Gainey is now the mayor of Pittsburgh, and is doing a lot of work to take on UPMC and hold them accountable. Josh Shapiro
is now our
It's
governor.
exactly, and I want to point something out that first of all, this makes sense because, you know, I spent a lot of time as a staffer working the Senate, working with governors on healthcare issues. When hospitals walk in your door, I've been lobbied. I was very involved in running the Affordable Care Act. They were spending $1 million a day lobbying us, $1 million a day. And there's 3 messages when they walk in the door. The first message is patience, patience, and then silence, right? Patience. That's what we're here for. The second message is, you are not paying us enough money. We are going to have to close our doors. You need to give us more money. And the third message is, and you've got to get out of our way. The government regulations, it's too much. We can't do the work that we need to do. And then when they're feeling really squeezed and or they're in a Republican office, the argument is jobs, as you were saying, jobs. Just don't forget, we're the jobs in your community, right? But on the other side of this, if you go to the American people, 75% of the American people know they are not getting the care they deserve, know they're getting ripped off, and are desperate for support. So if you can actually focus policymakers and have a movement behind you, you win. We won on no surprises. We won on prescription drug pricing. Right now, we're fighting it out on transparency. And what we're saying is, we deserve to know, what is the price? Right? We got the federal government to say, as a human being, when you walk into a hospital, they should be able to tell you in advance what the price is going to be. And guess what? They can't do it. They're violating the law. And now we're doubling down on this. We're saying, no, you're going to get bigger fines. You're going to get bigger penalties unless you can tell us what the price is. Yeah. Right? And I always make the point when I'm talking to senators and other folks about this. Just remember, you've heard 1,000 times from these hospitals, we're underpaid. But they can't tell you what their price is. Doesn't even make
And that
sense.
just is, we go everywhere else and we learn the calories even on
Right.
what's available to
Right.
us in a fast food joint. So pricing feels like it's something that transparency is good. I'm just going to get there.
And it's totally bipartisan.
And if I could just
Totally
give you,
bipartisan.
I want to tell a secret, something I've never said publicly. I didn't, I had no idea UPMC was a not-for-profit.
Oh, yeah. Oh, yeah.
And the secret really is here. I was working for 2 Republican members of Congress on the Hill, and again, I still have an R card, which I hopefully, what I'm trying to say here is that this does transcend partisan barriers.
Yeah.
Because when I was on Capitol Hill, as the Affordable Care Act was being crafted through my offices that I was serving, I was a junior legislative assistant for healthcare. I didn't leave Capitol Hill and get a job in lobbying. I became a general political consultant. And so that should tell you all that I had such a distaste for what I saw on both sides, because I felt nobody was addressing the problem. Vicki.
I just want to jump in there because when Sandra, when she met us, Chelsea Wagner was our county controller at the time. And she's the one that put out the grassroots effort.
Yeah.
She had a series of town hall meetings. And I'll tell you what, I showed up, I think at the last town hall meeting. It was probably about 25, 30 miles away from my house, around there. And I said, I'm ticked off. I'm not having this, I'm not accepting it. So it just happened that we were in the process of starting this grassroots effort, and when Sandra took on the daunting task of really finding out what was happening out there, I want to say this, that when we forget that we as patients I'm not a number to you. I have a heart. My heart beats every single day. And because of that, if I don't continue to put our voices out there along with the other advocates who are still working, this agreement was only for 10 years. We're 3.5 years into the agreement.
Don't give away too much.
Okay, I'm not. I won't give away too much.
Spoiler! I know.
some
You got to
spoiler
leave these guys
alerts.
with something.
All
Voice
I'm
of a
saying
director.
is- I guess all I'm saying is we really, you guys, when you see this film, please tell everybody about this film. Go to the schools, go to the medical schools, go to the nursing schools, go to your policymakers, go to everybody and anybody that's going to hear what you have to say. This is not an irrelevant topic. In fact, it's becoming even more urgent as we end up not having what we need to take care of our folks.
And listen, there's good news here. There is good news here. Massachusetts, Connecticut, Colorado, California, Oregon, these are all states that are now passed laws, and they're literally scrutinizing. It's the reason your comptroller was so mad. The money is crazy.
Yes.
They're scrutinizing these out-of-control prices, and I'm going on Wednesday, I'll be in Connecticut, in the state capitol, grilling the hospitals with the head of their healthcare affordability office to have them try to justify these outrageous prices. This is happening. The revolution is happening. But a lot more people need to wake up. And at the end of the day, the thing I don't want to miss here is, it sounds very wonky, but if you look at the wages, the money that we're making as American families, right, over the last 3 decades, they've been pretty much flat.
Right on.
And the biggest reason has been that almost all of the money that we should be taking home so we can decide when we want to retire, where our kids go to school, the kind of house we live in, that money has been flowing into healthcare. It is squeezing American families in the most profound way, and we need this revolution.
And there was a book I read long ago called Just Don't Get Sick that really impacted the way I look at things. And again, like I said, this isn't a partisan conversation.
No.
We can all talk about our stripes and who we vote for, but at the end of the day, there's issues. And so I wish we had a longer time to talk about all this, but I am going to strike you all with the lightning round real quick. But Frederick touched on an issue I'd be remiss if I didn't just mention. When I was sitting on Capitol Hill at the federal level again, I felt that the special interests, the lobbying, weren't serving anybody. And that's why our members of Congress couldn't do what they needed to do for us. And today in 2023, now 10 years after leaving Capitol Hill, I can say I still feel that way, but I'm optimistic about the future. But it takes nights like tonight, watching films like tonight, the important work you've done, Sandra, Vicki, the important work you're part of now as an advocate, not just as a nurse, and thank you for your service to your community. And Frederick, what you're advocating for, I really believe that change is possible, and a change that can really make all of our lives better in hospitals, in our communities, but around the country. If we talk about things like this, if we don't treat them as these very niche issues. So the lightning round question I have for you all before we wrap here is on the subject of nonprofit hospitals in particular. Can you quickly tell us, just literally 2 sentences, why these are worthy, the nonprofit hospitals, why they are worthy of special attention? And we'll start with you, Sandra, please.
Okay, and I also want to mention that the film is going to be streaming starting at the end of July on Google Play, Amazon Prime, Xbox, DirecTV, and iTunes. So please share. One of the things we've learned about the film is that it's kind of hard to get people excited about watching a documentary about healthcare consolidation. But when people actually watch it, they say, "Oh my gosh, I'm going to tell everybody I know. Everybody needs to watch this." So the word of mouth of this film is really going to be important. So please share and tell everybody. You can join the newsletter on our website, InHospitablefilm.com, and then you'll get the update of when and where it's going to be playing. But sorry, what was the question about nonprofits?
So why are nonprofit hospitals, why do they need our attention? And are why are they not even meeting these charitable missions that they say they have?
Well, I won't really answer
them.
I won't take very long because you'll learn that in the film. But basically, the answer is because they're taking money away from the community and patients and workers, and they're saying they're providing a charitable mission to the community in exchange for all these incredible tax breaks, and they're not giving back to the community the way they should, and they should just pay their taxes like everybody else.
So you got to be worthy of the tax breaks. That's a good message. Vicki, please, quickly. Thank you.
Going into my when I worked for UPMC, I paid for their insurance. I got in a very bad car accident in 2010. UPMC paid, my car insurance company paid the bulk of for my care, but UPMC, when I ended up suing the entity, had their hands out and they received $17,000 back from my settlement because they were a not-for-profit insurance agency. They should not exist as for not-for-profit because it dictates what happens with the care. My grandson's in the audience right now, Damarin. This is going to be the first time he's seen his granddad on film, and I'm really kind of worried because I'm afraid he's going to cry. But in all honesty, it tears apart families by us not getting the care that we need, and I shouldn't be 62 years old starting to restart my 401k again. Are you serious? No.
Yeah. And Vicki, what you said right there about that nonprofit status dictating what kind of care you get.
It does.
Wow. I need to sit with that.
Okay.
Frederick, please.
All right, so, and I would be remiss to not say this, but guys, if you want to be part of the fight, please come to familiesusa.org. You can get involved in any way you want. There's a million different fights we're having. This is a very important one, but we're also fighting for health equity. We're fighting to make sure that coverage is real and providing affordable care to folks. To answer your question, there's 3 answers. The first part, or a 3-part answer. The first part is the reason that nonprofit hospitals are getting away with this is because there is literally no legal requirement of any kind that they provide charity care. Nothing. 0 in federal law. 0.
That's astonishing.
So that's why they're getting away with it. We tried in the Affordable Care Act, we were trying to create a threshold of charity care they provide. That got watered down to a reporting requirement. So they have to report on community benefit, and it's not even enforced. They can write half a page or they can write 10 pages, it doesn't matter. Second thing I was gonna say is, I wanna be really clear about this. For-profits can also be terrible, and so can some of the religiously affiliated hospitals like the Catholics. They can be just as focused on dollars and maximizing revenue and not on what patients need. And similarly, there are also government-run hospitals, public hospitals that literally are the lifeline for their communities.
So let me just make the
jump. Every
jump.
hospital is bad, but you really have to look at the behavior of the individual hospital to figure out what's really going on there.
Thank you. That was really great. But if you don't mind me backing on that, because I want to jump to quickly, then what are the ways to ensure that they're meeting their charitable mission? That seems to me like, okay, this is happening. We know it's happening, but what can we do?
Yeah, well, I think we're working very hard. One of the things we're working very hard on this year, and we're winning, and by the way, it's totally bipartisan. I've been a Republican witness and a Democratic witness in Congress on this, is we are requiring transparency. We are requiring that we know what the price is, that we actually have the data that allows us to know, are you killing people? Are you saving people's lives? The very first step in all this is transparency. Once we can actually unveil what's happening, then we can start having the really meaty conversations about, do you deserve that nonprofit status? Why did in the last 10 years, hospital prices have increased 4 times faster than our paychecks? That is unforgivable, right? We need to unveil this stuff so we can get into the real meaty discussions of how do we create financial incentives so that hospitals' financial interests are aligned with patients and not against patients.
I want to wrap this by saying, you know, I might have surprised you all by mentioning all my ties to medicine. And again, I've studied it at the graduate level. I've had the privilege of working for 2 members of Congress. But my links to being the daughter of a physician, a wife of 1, and a sister of 2 now almost, I must say there's always a lot of misinformation out there. That physicians can't be great patient advocates, that nurses can't be great patient advocates just because they're in the system and profiting too. No, that's not true. Anyone can be a great patient advocate. We all need to stand up for truth, transparency, and do the right thing. My late dad, who made his career in the 70s, 80s, 90s here in the United States in numerous medical centers ranging from Duke University Medical Center to the foothills in southern West Virginia of those Appalachian Mountains. I will say he always told me how important it was to stand up for his patients, those who were indigent, couldn't afford care, and were coming through to formerly known as a miners hospital and is now known as Appalachian Regional Healthcare System based out of Kentucky. I've been lucky enough to see hospitals do the right thing, but I also know that so many don't. And I thank you 3, Sandra, Vicki, Fred, for your incredible insights tonight, sharing these with this audience, and let's get right to that screening. Thank you again. Enjoy tonight.
Thank you.
Thank you.